Assalamu alaikum. I'm Dr.rafique Pitafi here, going to discuss about the implantable contraceptions. These are very safe. These are also known as a JETED. These are very safe for those women that are at the reproductive age and parity, including the non-parous women who want highly effective long-term protection against the pregnancy, who are breastfeeding around about 6 weeks or more, who are postpartum and not breastfeeding, who are post abortion, and those that want to keep herself safe from any kind of pregnancy that can use it. Insertion for women without preceding hormone use, the ENG implants should be inserted within 5 days from the start of menses. When switching from oral contraceptive pills, insertion should occur within 7 days of the last active pill. Implants, and this is the implantation way you can see subdermal implantation, and this is means implantation should be done especially under the skin. Don't put into deep tissues or into the fat tissues, it may cause complexities. Local insertion site, that is a skin under the skin, and it should be parallel, not means it should be pointed upward or downward. You can see here the implant applicator skin fat tissues. So applicator is a machine that is required to insert the implanting capsule like structure. This is known as a jadal, yeah, implanting capsule. This is a progesterone mat, and this is responsible to protect you from the any kind of pregnancy. This is 99% protecting, yeah, preventing from the normal pregnancy or pregnancy in the emergency, especially after the birth of baby. This is especially for 3 years protection. Implantation of this contraceptive done especially on the arm, in inside under the skin. Progesterone implant, this is a capsule you can see here on the screen. This capsule should be introduced or inserted into the body under the skin. So there is a requirement of particular machine. That machine is known as the applicator machine. That is the applicator machine. First, we means use cotton swab, especially antiseptic, any material, and then mark with the marker the size of proper size of the capsule, proper size of progesterone implanting contraceptive JDLR you can see. Then we are able to insert it by the help of applicator. This is the applicator machine. We are inserting this one uh, smoothly should be inserted inside the female, below the skin, not into the deep fat tissues or into the muscular tissues. Then load it, you can see this is the loading mechanism. When we load it, it will be safe and very easy and very slightly feelings for the pain, yeah, pain feelings, especially inflammation feelings here. When we have to remove, then slightly cut it at their opening. Then by the help of scissor or other machine, we can remove out directly. So this machine is the applicator that we use especially for loading. And inside the body, this implanted contraceptive that release the hormone that's known as a progesterone hormone. This progesterone hormone especially act on female uterine wall and mucous membrane of the female cervix region, and also especially that effect on the female ovary. It prevent ovulation. It means reduce ovulatory mechanism inside the female body, and also it effect on the female uterine wall It decreases the thickness of uterine wall that is not suitable for the female implantation mechanism. So when uterine wall become thin, then implantation not occur. This one is the cervical region. Already I have told you this is a cervical region. Cervix become more thick. It do not allow sperms that reach inside the uterus for the implantation because cervix is completely closed. So pregnancy do not occur because this is 99% preventive. And here you can see the uterine lining. By this, uterine lining become thin. If uterine endometrium is thin, then implantation do not occur because implantation is totally concerned with the female endometrium. Endometrium is thick, then implantation occur, then pregnancy will be continue, then further process will be continue. If there is any kind of complexity after usage of this one, after usage of this contraceptive, there will be the inflammation inside the female body. If feel any inflammation, it required to take proper rest, proper care, proper especially diet, and rest is necessary, especially because rest take your yeah, maintain your hormonal control, that make your hormones in balance. If you have proper diet and proper rest and less stress, then you can maintain this one very easily up to 3 years, or again you can repeat it also. So if there is no proper dietary effect, or we can say proper sleep, then there will be the complexities. Then what type of complexities I will discuss here. First, there is a benefit of this one, highly effective, and this is rapidly effective, and as long term method. Pelvic examination is not required here, does not interfere with the intercourse, means sexual act don't affect on the sex or the sexual act, do not affect on the breastfeeding. If the she is breastfeeding her baby, then it make no difference. Weight gain, these are the disadvantages. Vaginal bleeding may occur at the irregular interval, means menses ups and down. It take a few months or before the time menses occur. When weight gain, acne and fluid retention, headache, breast problems, hair loss, mood change, abdominal pain, and these are the most effective problems, that is the breast pain, weight gain, headache, and nausea mechanism. So the person, the girl, a female who is suffering from this one, that should be take care of this one. Thank you very much. Keep watching and share it.